Okay. Hello, good morning, good afternoon, or good evening. I am Jennifer Safi, the UFSPA Vice President and the Internationalization Office Coordinator, and I would like to welcome you all to the second UFSPA Congress, Connecting Experiences in Global Health, and I would like to especially welcome you to our fourth Internationalization Symposium that is starting today, and we'll continue with a very exciting schedule until this Friday. This Congress targets the academic community and the whole society with the goal to discuss science, education, culture, and innovation. It is a space for learning, for exchanging knowledge and experiences, and seeking solutions for the problems that affect us. And let's take the opportunity this week to discuss the role of the international collaboration, cooperation, and the internationalization of higher education in the construction and the execution of policies and actions aimed to have a better world, to ensuring a healthy life and promoting the well-being of an entire world population. And we will discuss here in this symposium the academia's role in impacting global challenges among many other subjects. So I invite you all to take a look in our program. And I'm very happy today to welcome Ms. Tina Purnat from the World Health Organization, and she will discuss with us a very current and important theme that is infodemics, especially in the context of public health. And I'm very glad to see that our meeting has been announced at the WHO newsletter. So thank you, Tina, for all this support. And I would also like to thank our very small and very special big team from the Internationalization Office, especially Isabella, Bernardo, Gabriel, and Marilene, and the Communication and the Information Technology departments for making this happen today and this week. And just a friendly reminder to all the audience that those that are registered for the UFSPA Congress, you should watch this section logged in the Congress website in order to get your certification. And I would also now like to pass the word or the screen to our mediators, Dr. Johanna Billig and Dr. Melissa Fortes, who will introduce our keynote speaker. And I thank you all for being with us today and wish you all a very good meeting. So ladies, this screen is yours. Thank you.
Thank you, Jennifer. Good afternoon, everyone. Thank you for joining us today. I am Johanna Billig. I am a lecturer from the Department of Education and Humanities from UFCSPA. And with the help of my colleague, Melissa Fortes, I will have the pleasure to host and moderate this conference called Infodemic Resilience and Evolving Public Health Practice with Ms. Tina Purnat as a keynote speaker. Just before we introduce our speaker, let me contextualize how we came across Ms. Tina Purnat's work. Since 2019, Melissa Fortes, Ana Raquel Salgado, and I have been offering courses that deals with the phenomenon of disinformation. In 2020, we had the opportunity to be among the audience of the opening and closing conference of the first infodemiology in the opening and closing conference of the first infodemiology conference organized by WHO, an event which had among its goals to understand the multidisciplinary nature of infodemic management and to establish a community of practice and research. So I'll pass the floor to Melissa so she'll introduce our speaker. Thank you.
Thank you, Jennifer. Thank you, Johanna. So I'm Melissa Fortes. I'm also a lecturer at the Department of Health and Humanities at UFSPA. And on behalf of our colleagues, the whole university actually, let me say that we are honored and very pleased to have you here, Tina, with us today. So we thank you very much for accepting our invitation. And then I'll now introduce you to the audience. So I'll introduce your short specific to the audience. So Tina Purnat is a team lead for Infodemic Management in the unit for High Impact Events Preparedness, or High Impact Event Preparedness, Department of Global Infections Hazard Preparedness at WHO. Tina has worked for over 20 years at the WHO, European Union, and academia. Her expertise amalgamates health research, analysis, and policy making with an emphasis on promoting the use of health information and evidence in decision making and for policy making. As part of the WHO COVID-19 response, she worked in developing and formulating WHO infodemic response and infodemic management interventions, for which she received the WHO Pathfinder and Innovation Award 2021. Congratulations on that, Tina. And so after her speech, we'll be taking questions and comments by the audience, and those should be sent through the chat box on the UFCSPA Congress platform, and also on the YouTube channel on the chat box on the YouTube for those of you who are joining us in the YouTube. So Tina, once again, thank you very much, and the floor is yours. Thank you.
Thank you for a really nice introduction. I'm very happy to be here with you, and I also look forward to our discussion later. It's really I feel really honored that we have this opportunity to talk today. I just like to apologize in advance to all of you. So I have a little bit of a cold, and I will be coughing a bit, but I hope that's not too disturbing to the conversation. And I did actually prepare some PowerPoint slides, but I promise they're not going to kill anyone. I hope. So let's see, and just let me know if you see my screen. Yes.
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 So yes, I have a big task. I need to speak to you today about the infodemic, and I'd like to, during the course of my talk, just outline to you some of the views or angles from which we can view the infodemic, especially when it comes to the matter of promoting health behaviors. And this is especially during the pandemic nowadays, very important. So really, the first point that I want to make is that our working environment is changing, and really, over the past 22 months or so, we've all worked and lived through a total society event, and we still are living in it. And it's really been the first time when, as public health practitioners and as people, we all been faced by the full impact of how much the technology progress has changed how we connect with each other, how we make decisions, how we enact health behaviors, how we influence each other in personal and also in professional lives. So in effect, we've experienced amplification and spread of information of all kinds, including concerns and questions, rumors, misinformation, and information of varying quality. And we describe this phenomenon as an infodemic. Now, early last year, we knew from past experience that rumors and trust influence how effectively we can engage with people and with patients and with communities that are affected by an epidemic. So they also influence the uptake of epidemic management measures by people. So when we're living in a protracted pandemic, responders and health systems are exhausted. People have faced adversity from loosening of social cohesion, from the threat to their livelihoods. And now, in November, end of November 2021, the COVID infodemic is actually blending with the COVID-19 vaccine infodemic, with the influenza infodemic, and with the wider political and societal challenges that we're facing. And on the other hand, the health systems are exhausted, and you have programs like immunization, for example, where the work is actually intensifying in many countries of the world. So, you know, in globally, political policy leaders are discussing how do we build back better after such a total society event. And as we recognize that we need to understand and support resilience of health systems and communities, I would also argue that we need to think about how this can be done within the influence of the digital information ecosystem. So the story and the work environment that we work in has really changed. Our epidemic management tools can actually be more effective if we recognize that the societal dynamics influence how our public health system works and how people experience our work and how we ourselves work. So we can't really solve societal problems through the health system, not all of them, but we certainly cannot solve the infodemic through the health system. But it is our responsibility as practitioners and health professionals to think about what is in the domain of our influence within health authorities, within health facilities, community-based care. So what can we do? What can be changed so that we can promote better uptake of epidemic mitigation measures by people? So public health and social measures, masking, etc., by vulnerable communities and by society in general. So we as public health practitioners, we're challenged to imagine how can we ensure this uptake of vaccines and public health and social measures and pharmaceutical interventions. And you know, the infodemic is a global phenomenon, but to reduce its harmful effect on our ability to control the pandemic, we need everyone involved. We need all parts of the health system involved. We need all parts of the society involved, and we need to manage it across multiple levels and communities, both from local and global. So, you know, this phenomenon is really, really complex. And it also means that the managing of infodemics is difficult. So so it's also really difficult then to create an environment that supports healthy behaviors. So the way that I like to think about it is actually that we as public health practitioners, as health professionals, we work at the interface between society and populations. So the way society functions is changing all around us. So we also need to think about how this is pressuring us to consider changing the way that we in public health work. And, you know, during the pandemic, we've actually experienced the perfect storm. Here's the context, what has changed. And this perfect storm actually makes it hard to encourage healthy behaviors in the population. What's the first layer? The first layer is that we have a global pandemic that is changing by the minute in terms of its effects and what we know about it. And this is transpiring differently in different parts of the world. The experience of the pandemic is local in many respects. And this is largely also being understood through the internet. We communicate through the internet. So where we, health authorities like WHO and other organizations, we must communicate about what we know about the pandemic. And at the same time, we know that local television or local internet coverage, they would be topping up that information for people in specific locales and telling them what they should be taking on board. So the problem is that the global flows of information move faster than the local response. So you can be living in Pakistan and find out what the US CDC thinks about COVID-19 before you know what the health authorities in Lahore think what you should be doing. So the second layer of the complexity is that we also need to understand that the historical trajectory of this particular virus and the disease, it lent itself to a lot of country against country narratives, the geopolitical dimension. So conversations and narratives have been changing depending on what month and what year we're in. For example, things like whether it's the Wuhan virus or the Indian or South African variant, and this is why things like insisting on correct nomenclature for using things like COVID-19 or the Delta or the Omicron variants, it's very, very important. This is not just linguistic splitting hairs. It's making it clear that we need to separate out scientific information that can save people's lives from stories and rumors about neighbors who we're in struggle with and that sell media. And this is, a really important thing to consider, because we shouldn't be using, life-threatening illness for media promotion, etc. And fuel stigmatization or for example pit one person against another person. And then the third layer, the other layer that's important here is that it's important, I think, as much as possible to understand also the distinction between misinformation and disinformation. These are terms that fly around a lot and are used in different ways, but disinformation is intentionally and maliciously placed, and it's absolutely part of the information warfare strategy that's happening around the world. There's malicious actors connected to extremist movements, race narratives, gender superiority narratives, all kinds of things that are being discussed on the internet. But actually, it's also important to realize that misinformation, for all we know, is just as harmful as disinformation, because it's scary, to think that way, because we often think that disinformation, is much serious and misinformation is more innocent, right? But the thing is, you still will have illness and maybe death at the end of both of these, whether there was intention or not. So we can see in local context how misinformation has been playing out around the world in terms of regional conflict, perhaps stigmatization, who's going to get vaccine and who has to wait. You're seeing it in terms of discussion about which is more important, being able to find food or shelter, or being able to have those things. So, when we're in that type of environment, people are fatigued, and it's hard for them to think critically because they're being pulled in a lot of different directions. We are as well. And we couldn't cook up actually a more perfect recipe for misinformation to spread, actually. It has also been a perfect recipe for straining the health system and the relationship between people and the health system. So then, okay, how can we think about what health professionals can even do in this challenge? Well, here's one thought. People are in the eye of the infodemic and pandemic. So what is the way out of the pandemic? It's through collective action, when enough people enact behaviors that protect the whole population. And this is what we're asking people to do. We're asking people to get vaccinated. We're asking people to physically distance or wash hands. We're asking them to face economic hardship. They face stress in the family as we're trying to manage the pandemic. It's not comfortable. It's not pleasant for anyone. But in times of hardship and uncertainty, that human mind seeks certainty and simplicity in this storm, I guess you would call it. And, humans, well, we tend to interpret what we experience within the frame of what we already know. So this is called confirmation bias. And in uncertain times, that self-preservation instinct of the human mind kicks in, and people go back to thinking patterns and habits that they know. So especially in uncertainty, people judge health topics through the lens of their worldviews. There is less opportunity to deliberate open thinking. Or another example, for example, a patient with autoimmune disease, they may have had really difficult time going through the health system, finding help. It was difficult for them to try and get diagnosed and treated. So they feel that they need to take care of themselves and of their health, and they take pride that they can control their health and their body. And there is very little step from this pride of being in control of your own health to thinking that I know what's best for my health and I don't need vaccines or medicines and I know how to help myself. And this dynamic, it also influences how people connect or perceive health workers, how they perceive health services or the health system in general. So, for example, in communities where there is deep distrust of the health system, or when people have had bad experience with the health services, they will distrust also any government or health authority action related to COVID-19 response. So working with communities or people that have weak linkage to health services or prevention, it really requires a thoughtful approach to understand what their experience has been like and how to work with them to encourage healthy behaviors. So another factor that influences people's behaviors now is pandemic fatigue. So people are exhausted and they're tired of the shocks to their lives and to their families and to their livelihoods. So they no longer as easily adhere to public health and social measures or to public health guidance. And we can see this across the world as people are returning, people are actually returning to pre-pandemic socialization. Especially young people are driven to socialize, almost 2 years of being cut off from their peers. And people's perception of the emergency is changing. So it seems that it's easier for people to think of this uncertainty as a new normal and as a new baseline, instead of feeling anxious or uncertain constantly. So studies from across the world are showing that risk perception of COVID-19 is stagnant or it's dropping in some parts of the world or in communities. So people feel that they are personally less at risk of COVID-19 than a year ago. And then the third point I'd like to make here is that sometimes it literally also comes down to people's access to reliable information on what are actually the recommended protective behaviors that people should do. So I mentioned, those groups and communities that tend to be less connected to the health system. They tend to be the ones that have less access to reliable information. And that means they're double vulnerable. This may be because of language barriers or health literacy, or merely just not having many ways to receive information about health. And I see access to health information as the absolute foundation to even start talking and discussing health guidance with patients or populations. It's a fact. This is really a fact, and we need to think really out of the box how we take the opportunity of when we interact with the communities, population, and individuals to provide health information in an effective way. So, in most countries, health professionals are still the most trusted source of health information and guidance for people. So we ourselves are at the center of healthy behaviors too. And we have a very, very important role to play in how people we serve will ultimately take action to healthy behaviors. We often forget that health workers and public health practitioners are an important part of this equation. But, we are people as well. And we all wear multiple hats in our lives. We are health professionals, but we also have families. We are ourselves parts of communities where we live and we work, pray, learn, play, where we gather. And our own experience of being overwhelmed affects our own behavior too. And overwhelmed health systems are not just a faceless institution. They're built on people. So, for example, as we see healthcare workers burnt out and exhausted, we observe health workers leaving the health system, leaving their jobs. And another phenomenon is empathy fatigue. There is still major inequality in access to vaccine in many countries around the world. But where vaccines were freely available, but people were choosing not to get vaccinated, we've observed empathy fatigue among health workers. So I think one surprise, perhaps to many people, of the rollout of the COVID-19 vaccines across the world is that in many places, we just assumed that once vaccines were available, healthcare workers would get vaccinated. And many countries prioritized health workers as priority groups to receive vaccinations first. But I think we underestimated that health workers are humans with questions and concerns as well. The way we pay attention to provide information and discuss with our patients to participate in their choice to take action and get vaccinated, well, we need to provide this to health workers as well. If health workers are not comfortable with making a decision for themselves to enact health behavior, well, whether it's getting vaccinated or adhering to public health guidance, public health social measures, well, then how can we expect that they have the tools and the opportunity to encourage their own patients and people in the community to do the same? And all of these complexities of human choice and human behaviors, these are the true cost of the infodemic on people's behaviors. But if we're trying to encourage humans to take healthy actions, well, then this is even harder because of how our society is changing and what the health system can do to adapt to societal changes. First, one major challenge is that because we're now living in a digitally connected world, information is produced and exchanged and consumed so much faster. But we do need to understand that this problem of information overflow is not new. When I think back to the creation of the World Wide Web and Tim Berners-Lee, and this was 32 years ago, we have 32 years of people producing and sharing any kinds of content without any control. And internet platforms have also changed in the meantime. At its creation, the internet was to be the most democratic place on earth, and the idea of the web was chaotic by definition. So we find ourselves 32 years later as a society in a time when we're trying to put rules. But it's important to keep in mind that we will not make the infodemic go away. And at the same time, we must be patient, stop, learn and introduce tools and policies that coexist with the infodemic. So, we need not to control or eliminate the infodemic. That will really not be possible. Because if we think that if we will control or that we will stop the infodemic, actually, in my opinion, we will fail. This is at least how I see the digital system, ecosystem. But because this is staying with us forever, we need to then work on early education. I take a lot of inspiration from, for example, the fight against non-communicable diseases. Colleagues that do health promotion, health education, for example, when they talk about healthy foods, healthy lifestyles, and that is part of primary education in schools. We need to also talk about primary education in schools about information access and evidence. We need to teach people how to search, how to assess quality of information they receive, be aware of the cognitive shortcuts that the human brain does when processing information, so that later on in their professional lives and through all stages of their lives, they will understand how to deal with false information and the overabundance of information. So for the second point, let's think about what health information has meant to people. Outside of emergencies or acute health events, health information is in the back of people's minds. Before an emergency, imagine we mostly receive health information and recommendations through our healthcare provider or during prevention activities. So outside of emergencies, humans are often passive consumers of health information. But during an emergency, health information becomes valued personally. It's relevant to people because it matters to them and their families. So people actively seek health information, and they also try to navigate this overabundance of information through others that they trust. There's too much information. They focus on people that they trust. And this means that people have sort of heightened receptivity for health-related information. But on the other hand, we have an increase in generation of health information from a variety of sources. Many more people are writing or talking about COVID-19 than they did previously about health information. And there's this tension between wanting to answer questions immediately and the fact that science is iterative, it takes time. There's, for example, there's been a huge increase in rapid publishing of COVID-19 related papers. You know yourselves, public health practice is evidence-based. So, there are challenges with the way that research is produced, the way that it's curated, the way that it is communicated. Before, scientists have historically not had to explain to the public how science works or why people change their minds when new research and new evidence are available. But now, scientific process is visible to everyone. And when you add here also that there are many different and new communication channels and many people talking about this, well, that's creating confusion around what information is real and what can be trusted. So this is even outside the scope of talking about misinformation. This is the reality of information ecosystem, society that we live in. And then there's a third point. Public health and health systems have not been invested in enough in many countries. We've been trying to do a lot with capacities that are available to us. But if we really want to encourage behavior change of people, well, then the health system would need to also adapt to the challenges that we face because of the way that the society is changing. So that means that we as health practitioners must do our job not just technically, we also need to manage gaps or inconsistencies in our health system or in public health practice. So we're trying to fill these gaps. Then, of course, it's harder to think about how we could work better or how our public health system could function better or how we can work with people and populations. And this means that it's harder to strengthen our health systems and how we work. But what that means is that the health system and public health practice, I think we're already a little bit behind what is needed to enable healthy behaviors with this challenge that I'm describing about the changing information and societal environment. So, colleagues that work in health promotion or in HIV or in antimicrobial resistance, they understand that it takes time and consistent work to build systems to promote healthy behaviors. So just think, how many of you decided at the beginning of this year to either eat better or to exercise more? And how many of you are actually still doing it now, 11 months later? I mean, we're all humans and it's hard to change habits and health behaviors. Okay, but where are stories of great success in collective health behaviors in times of adversity? We actually do have examples of countries that, despite being in the storm of information confusion, conflicting messages, mis and disinformation, they actually have succeeded having very high vaccination coverage of COVID-19 vaccine. So my friend Isabella Balalai from the Brazilian Immunization Society, she explained to me the story of Brazilian uptake of COVID-19 vaccines. And the story of Brazilian trust in vaccines is a story of resilience. Brazil has achieved high vaccine confidence with very empathic, human-centered immunization and communication campaigns at the time when in the country, immunopreventable diseases were major causes of infant mortality. And this was very effective work of Brazilian immunization programs in communities. But over time, this high immunization coverage eliminated or controlled these diseases. So the risk perception of people related to these diseases has decreased. So now the vaccination coverage for these diseases has also decreased. You can see here. And this decrease. So at the same time, the communication from health authorities, from the government has changed, and it's not as empathic. So over the years, the number of different vaccines also increased. So the immunization schedule has become more complex, and this has also made it much harder for caregivers to take action to get vaccinated, to get their children vaccinated, and also for health workers with the complexity of the immunization schedule, so that for health workers to support this decision by people. But here's a remarkable view. Brazil has faced social political challenges in mixed messaging and perhaps less empathic communication about COVID-19, and a volatile environment in mis and disinformation. But still, 93% of unvaccinated Brazilians said in early this year that they would get vaccinated against COVID-19. And they have. So Brazil has very good uptake of COVID-19 vaccine. So in the face of an emergency, as it was, for example, in 2016 for influenza, and in 2017 for yellow fever, and now for COVID-19, the uptake of vaccination is actually really high. So, Brazilian communities, they continue to believe in vaccines, and they readily adhere as long as they understand the risk. So fake information or confusion, yes, they get in the way. But when people are in acute emergency and they want to protect themselves from disease, Brazilians get vaccinated. And really, the take-home message from this is that this is a measure of how much trust people and community have in the health system and in the vaccination. And this is something that has been built between the population and the health system over time. This is what resilience means. So what can we learn from the Brazilian example, actually? That we must build this trust into the health system, that we need to build it over time. And it will take all of us to build and maintain this trust. So we don't start building trust when emergency happens. You need to have that before. So there needs to be an environment then that enables healthy behaviors when there is an emergency, or when there is no emergency as well. So I think the way that we can do this is by promoting human-centered approaches to how we communicate, and also how we work as practitioners. Many things related to the information ecosystem or problems of mis and disinformation are outside of health systems control. But what we do have control over is how public health practice is conducted, how we work, and how we can help. So, how can we then help people along this journey towards health behaviors? Our health system and our practices must be, I think, more focused on humans. How are we designing our services? How are we designing our communication so that people feel that they own the decision to take step towards healthy behavior? And of course, I work in an international organization supporting countries in health policy formation. Of course, we also need to work across sectors, for example, in education, to add information and digital literacy into health literacy curricula. But how do we do this as health professionals, practically, as health science researchers and educators? Well, we need to all realize that every one of us has a role to play in changing the health behavior of the population, because each interaction of people with the health system will give people an experience they will remember. And this experience will build their trust in the health system and in the health guidance. So every encounter with the patient or with the people in the communities count. It lays down the road to healthy behaviors. And I think in addition, actually, I think that we need to treat each other with this type of empathy and human-centeredness as well. So how are we going to promote healthy behaviors in communities if we do not apply the same empathy and understanding to ourselves and to our teams? So let's invest in discussing with health professionals amongst each other any concerns and questions that we may have, or the skills we feel that we need, so that we can better engage with people inside the health setting and outside of it. So, really to conclude, I wanted to leave you with a few ideas that you could perhaps apply, how you could apply what I just talked about. So one suggestion is that you can leverage the trust that the patients and the communities place in you by encouraging open and empathic conversation about topics that may cause them worry or anxiety or concern. So you can make an environment where patients can ask questions without being judged. And this approach is also really important in medical education, or for example, in interactions between medical librarians and patients, when patients seek information about their own conditions. This is extremely important as well, not just in the health setting, but in all of the interactions with the health system. The second idea is consider also your role outside the one-on-one conversations you have with patients or in the communities. So what role do you play as an amplifier that has social credibility in your circles and in your environment? You make a difference. So for those of you who have grown up with social media, the undergraduate students, graduate students, embrace your digital native and use your influence on the internet to engage with people. There are some interesting examples of this online. For example, there's a medical doctor online present on social media termed your friendly neighborhood epidemiologist. And she's bridging these conversations between health science and her Christian community. Or for example, health workers have gathered together in the US and Canada under the hashtag "This is our shot." And they're using social media and their digital identities online to engage with people. And then lastly, I think you can continue working also through your work at your university, through your studies in the communities, whether you're a student or a teacher or a librarian or an administrator. Your work makes a difference in bringing more knowledge and more health professionals into the health system. So be aware of the changes that come at the health system because of the changes from digitalization of society. Continue maintaining this trusted relationship with the community in Brazil. So I will stop here. I hope I hit the mark on the timing, and I'd be very happy to have a discussion.
Thank you very much, Tina, for this wonderful talk, this wonderful ideas for us to sleep with, right? We are getting questions from the chats, and while we are getting those questions, I have a special one for you. You mentioned a lot about empathy, communication, building trust. You also mentioned now in Brazil we are going through a process in which we are rediscussing our curricula in order to guarantee that our students will have the opportunities to get closer to their communities and to cooperate with the communities, right? And I thought that maybe by discussing the topic of infodemic, by getting to know about this phenomenon, they can also learn how to, or what they should have in mind when trying to cooperate with their communities. And I also have heard that we have some universities that are adding that to their curriculum. Can you tell us a little bit about that?
Yes, I mean, when you mentioned this to me when we first time spoke, I was very impressed that there is such an awareness of the importance of community engagement. I hope that I sort of convinced you through my talk that if we want to to provide an enabling environment for people to take healthy choices, healthy behaviors, we actually do need to have quite a close relationship and a two-way relationship with communities and with people, actually with individuals as well. So and that's definitely something that can be trained, it can be practiced, and we can learn from interactions with patients, with communities, that brings back into our practice as well. So this type of discussion about the infodemic, but what drives people's behaviors in general, but also access to health information, all of this is relevant to all parts to many parts, I would say probably all of our profiles as public health practitioners and health professionals. So this is very, very timely discussion. And yes, there are other universities around the world that are bringing in the topic of infodemic into their curricula from different perspectives. There is, for example, undergraduate courses in UK, University of Manchester, that are bringing this in from the perspective of actually digital society, public health, social media, etc. Then there's other universities, for example, in Italy, that are looking at it from public health perspective. Or University of Lyon in France applied this perspective specifically to immunization. And for a variety of reasons, there are some programs in public health that have a longer practice, longer experience, thinking about how to promote and and enable health behaviors in a particular health program. So this is definitely becoming a part of attention, and I think it's extremely important for young people to bring this into practice, to learn it, practice it, because we need to keep practicing the empathy, the connection we have with the community, with patients, and with people in general. This is something that it needs to be a two-way street. Yeah.
So thank you again, Tina. We here on the chat, we have lots of compliments. So people are very happy with your talk, and
Oh,
they are
good.
lots of compliments. They have no questions, but they would like to congratulate you and thank you. And I guess there is one. No, let's see here. No, they. There is one question here, but before this question, I'd like to ask you another one, and then I can pass to you the question that I just got
Perfect.
here. The question that I have, that we talked a little bit before, is the measurement of the impact of infodemics on health behaviors. So how to measure that? That's a big question, right? And especially, as you said, infodemic is global, but the response and the solutions should be local. So how can we locally measure the impact of infodemics on health behaviors?
Yeah. So thanks, Melissa, for this question. This is complex. So therefore, of course, measurement is complex. The difficulty is, when we're working in the health system, is that we will only observe the infodemic impact when enough people change behavior one way or another, and we will start seeing behavior manifesting itself sometimes in the information ecosystem. So how people are getting information, how they're searching for it, how it is spreading, what is being talked about. Sometimes you will observe it actually through it's sometimes good to just talk to practitioners that are working in the communities, or that are working with patients, because they will give you anecdotal, we're seeing this XYZ, and we're getting more and more certain reports, for example. But then, when it comes to the health system, sometimes we will see it through poison control lines, etc., or we start seeing delayed care. So this is an impact of infodemic as well, that people come into to the ICUs with much more severe disease because they delayed treatment or they self-treated, right? This is all impact. Some, at societal level, it would be lawsuits, frivolous lawsuits against hospitals or against doctors or health authorities. So the challenge of the measurement is that it has so many different layers, and we're still, trying to understand how we connect those together. But what is already clear is that we need to think about how we can act. And this is why, at WHO, we're thinking about, okay, one way of the best prevention from harm of infodemic, of mis and disinformation, is actually to think holistically how, through many different types of interventions, we can create an enabling environment for people to act. And of course, health system, we can use all of the tools that we have in the health system and in our practices to do so. This is actually, the measurement of infodemic burden is actually something that we feel is really important to advance. And we just recently, 2 weeks ago, finished an WHO infodemic management conference that specifically was looking at measurement. It's something that we also want to continue discussion with academia, but it's really important to actually have this connection between research, the academia, and the practice. And this is why I think the way that your university works, the way that you train both health professionals, but also have the academic rigor in the programs, that's actually what's needed. We need the practice and the science together to improve faster, the knowledge that we have.
Yeah, basically research approaches that will give you the bird's eye view, but also the bottom-up view. So the qualitative, the highly qualitative approaches, and also the broader approaches. Thank you very much.
Participatory research is actually really important. So we need to use different kinds of research in order to answer different questions about the infodemic. So what's very common, for example, is using informatics to computational methods to characterize, for example, conversations, social media. But actually, the qualitative participatory research is actually extremely important, and that's actually what connects also to the empathy and community engagement, because it's not just about that we generate evidence. It's not for the sake of research. When we do participatory research with the community and with people, it actually is a form of advocacy as well. It's a form of knowledge building, knowledge transfer, and it's really an important piece. I was telling you earlier, I actually learned. My undergraduate degree is in economics of social science, but I was trained in graduate school as a biomedical informatician, and I learned qualitative research. Actually, my first assignment in my master's program was joining a care team in a teaching hospital, where I needed to, for 1 month, follow health personnel as they were taking care of patients. And my job was to understand information flows and the tools that people used so that I could understand what matters to them in their job before I was even, allowed to start thinking, oh, let's put computers into the space. So, I appreciated, I got a very hardcore training of how important it is not only to use qualitative research, but also to understand that it's important how we work as health practitioners together, and that affects a lot what kind of quality of care the patient, for example, receives. So we need both. We need qualitative and quantitative evidence together, depending on what we're trying to address. But when we deal with humans, we need to also make sure that we have this interdisciplinarity in place.
Yeah, especially if we are concerned with modifying health behaviors. So understand how people relate to the system, how people relate to health, their own health, and other people's health and healthcare, etc. Thank you very much. We are now getting questions, so I'll read the questions here to you. So the first question that we got is by Vinicius Santana. Yes, so he says, amazing speech, very enlightening and important as a beacon of hope through this infodemic that has so deep political roots. Thank you so much, Tina. No, the question comes after by Alan, or Alan. I'd like to ask Tina how she sees, based on her experience, the proper usage of the internet as a method in which healthcare professionals can engage with the general public beyond just when there is a need to. So beyond that, right? So I'm not sure if you got the question. Did you get the question?
Yes.
Okay.
So here's the thing. I did mention that, especially those of you who have grown up with the use of the internet. I got exposed to the internet when I was 19 in the university. I'm still that generation. But those of you who are digital natives, of course, you are very fluent in the language of the internet. And no joke, it's really true. In every country of the world, health professionals are still one of the most, if not the most trusted sources of health information for people. You have a really important role in your job and in society. So whether you communicate with and engage with the community offline, or if you engage with a community online, and yourselves, internet is not monolithic. Fine, you post on Twitter and that is very public, but yourself that there are pockets of communities on TikTok, on all kinds of other groups that your voice matters. And exercising that fluency online matters a lot. So I gave you a couple of examples. So hashtag this is our shot, very fascinating movement of health professionals. I think it's over 40, if not even 50,000 health professionals in North America that are engaging and promoting right now immunization in North America. But that voice is very, very, very important to have. I forget. I think there was a second part of the question. No.
I guess no. This question, no. I guess that's the question itself.
Yeah,
But
okay.
then Paola, yeah, we have. Oh, Paola was the one that she made a comment, and then she made a question, right? So the comment was the comment that I started reading before, that she manages that social, in her imagination, social media in general has played an important role in dispersing poor information. But you have mentioned in your talk that enforcing rules may not be the most effective way to stop infodemics on the internet. And then the question came after. So the question is, in addition to preventive education or engaging with people through our profiles, should we put some pressure on private companies responsible for social media? Should we ask for another type of government actions? Okay, so that's the question now.
Yeah. So here's the complexity. I mentioned that the internet is 32 years old, and we're only now talking about governance. That means we need to give ourselves enough time to be very careful what governance of internet should look like. There is, you may know, the UNESCO, the UN Agency for Education, Culture. They work a lot, and they have documented across the world how sometimes even well-intended policies of punishing people that spread misinformation when countries implement something like that, that actually may lead to stifling of public conversation, and it curbs freedom. It can curb freedom of expression, and that is then a serious societal consequence when you're trying to solve something and then you end up causing another issue. So we have to be really, really careful in this. Now, we as health professionals, we cannot influence the the internet platforms. But of course, there's discussions in society going on this, and I think it's healthy to be discussing this. But here's a bit of a devil's advocate thought for you. So we right now understand each other in this conversation, and you understand what I'm telling you because you have a context. It's a context of a symposium. It's a context of me, talking, giving a keynote talk, and we are having a discussion. You would understand me very differently if we just met each other in a bar in a completely different context, and you would pay attention to me differently. You would interpret what I say differently. You would not be in the zone. Okay, I came here to listen, for example. So, but that's literally what the internet is. The internet is a social space. So, are we serious saying that we want to have serious health information conversations in a bar? Because that's literally, it's the same as having conversation on the internet in the same, for example, Facebook feed, where, one person could be exchanging some kind of, like family photos and memes about, your cat and things like that. We expect that the platforms that were designed for social interaction need to be duplicated or need to be used for serious conversation. We don't have a space on the internet where we could have a safe discussion about health information. Same as we don't have a space on the internet where we could have a constructive discussion, safe discussion about climate change. And we need to imagine ourselves that yes, we all are wanting to use the internet because it is personalized, right? People are on Facebook because they like the personal feed that they get, and that feed is algorithmically curated, and it gives you suggestions based on what the algorithm thinks you want to see. And that means that you will get a certain type of content that amplifies not boring stuff. Health information is boring. It means a serious conversation. So we don't have that space on the internet. No one has a solution for this. But this is the type of conversation that we as health professionals can bring in to the discussion, because we have experience speaking to patients. We have experience also through what makes a person feel safe to make a choice to act, to decide to take vaccine, to decide to take a hard, very taxing treatment, for example, cancer treatment or something like that, instead of an alternative treatment in oncology, for example. We know what makes people enact healthy behaviors, and our contribution as part of society, as citizens, is actually to contribute to those discussions as well. So not to be discounted, our different hats that we're wearing. But no, we cannot have, discussions about health information in a bar. We need to have a different setting. And internet doesn't have that yet. It's 32 years old.
Yeah.
We don't have governance yet.
But you know what? Maybe I'm being optimistic, but I believe we'll be able to achieve that, because we do not. I I do not, but people do business deals in bars and restaurants, for example, and those are serious conversations,
Yes.
I guess. So
Yeah.
you see, I guess we have to work hard. I know, but no, I'm positive
Well,
we'll find a solution.
I
Melissa,
just
was actually-
reminded of an event we have here in Brazil. It's called Pint of Science, in which people discuss science through beer.
Oh, cool.
Yeah.
That is
Having
awesome.
pints of beer,
Yes,
yes,
pint
yes,
of science.
yes. So, pint of
Wow.
science. This is
Yes,
an
that
event
is
here in Brazil.
amazing.
Yes.
That is actually the perfect thing. Of course, it's serious conversation, but you need to actually take it with humor. Like humor is the best when it comes to connection with people. That is amazing. That is really amazing. You know, when I was when I was studying or reading up a bit about acceptance of, how technology has changed society, and technology in very broad sense. When printing press was invented, there were all of a sudden books were able to be printed at a much higher volume, and not only books like the religious text, etc., also trade texts. So people that had a trade, that they have a vocation, a profession, they were able to have a manual faster, which meant that knowledge spread so much faster. There were objections to that. Who can have access to that and who doesn't? When the telegraph was established, people were concerned that how can you communicate in 3-4 short sentences? You cannot do that. There is no quality in communication. And now we have Twitter, right? Or when radio and TV were invented, there were serious, threats to, it's going to change the way that our family functions, the family dynamic. So yes, of course, internet as another technology has different layers of impact on the society, but we as a society can impact it too, and it has permanently changed how we work and live and how we connect. And we will I am also hopeful, Melissa, because our society and how we live is going to change. The catch is that the health system and public health practice keeps up. We should be, in parallel to this, not sticking with what we currently have, but we need to find a way to evolve and keep up.
It's about lifelong
Yeah,
learning. So we have questions here also from the conference chat box, and I think I can connect that with one question I have here. People are talking about getting ready for the next pandemic. What about getting ready for the next infodemic? And Ana Luisa Freitas here in our chat box asked, what are the kind of management training should we have? And thinking of formation of future health professionals and also capacity building of the current workforce. So
Yes.
How do we get ready for the next?
So this is a big question. It's a very good question. To put my serious hat on, working for WHO, we actually have worked together with other health authorities and experts in health education to build the first, or to define the first, competency framework for infodemic management. So it's actually you can find it on our website. And what we hoped to do with this is that can be at least an outline or a start of the discussion. What are the competencies? What are the skills that people working in the health system, in public health, need to have? Now, depending on what role, what profile you are, you will have one or like a different combination of this. But we actually have seriously thought about this, and we hope that this will evolve and update from the experience. The way that you will also, for example, through the experience of your curriculum changes, I would actually invite Jennifer, your team needs to give us feedback then into the next iteration of the competence framework as well. So based on that, we hope that health authorities and universities would reflect on what they could do in the trainings of the new generations. But then, for the continuing education, that's useful as well. So we have actually modeled our WHO Infodemic Manager training on established field epidemiology trainings. So those of you who work in epidemiology, these are premier programs that train up people so that they have all the tools and the skills necessary to quickly go and deploy and help respond to an outbreak. And WHO has also together with partners, many partners organize this WHO Infodemic Manager training. It's actually taking place just now. It's intense. It's 4 weeks long and currently finishing up next week. So those of you who are already in your careers, you can apply and join these types of trainings. There are also curricula and trainings, open trainings that we will post on Open WHO. So this is a WHO platform where open courses, online courses are available. I would also encourage to join up with people in your own university, your own community that are interested in these topics, and see if you can collaborate either with the faculty at the university on a project or or through your practice. And what's really important is to feed that back, whether you reported at at the beer slam talking about science, or you reported back to academic journals, etc. All of this is really important types of training, and just keep in mind, this is such a new phenomenon. The work has really kicked off only last year. And that means that what we're trying to do, imagine non-communicable diseases, it took easily 20 years, if not longer, before we came from realization that non-communicable diseases are a problem to having all of the policy frameworks and all of the measurements defined and all of the interventions defined, right? It was a long period of time. What we're trying to do now is shorten this for the infodemic, because if we wait 20 years, actually the internet technology in our society will be totally different in 20 years. So we have to be faster. And that's why participatory research is important. That's why human-centeredness is important, because we will get results faster and we will learn faster if we change our approach to how we learn and work with communities.
I guess you summed up some of the questions, Johanna. Is that what you did? Because I see that Tina has just approached what is in the question by Professor Helena Barros, Professor Ayrton Stein, and Professor Ana Luisa, because they're asking about training health professionals and journalists, and also the centralization of this information and a quick feedback. Right, so this is what their questions are about, and management training on so that we can respond to the infodemic. So I guess the question
Melissa,
you asked kind of sums up, right?
I think actually I did forget. Sorry, I was so focused on the public health aspect in the health system. Yes, I mean, your colleague brings up a really good point. Another way for us as health professionals to have a voice. So one way of doing things is that you engage online and you're the digital native. But the other way that you can have serious impact is that you also work with journalists. Journalists are the ones that know how to communicate health information, especially those that are science journalists. So yes, training of journalists, but also making yourself available to be able to explain science, explain a particular topic, so that they can ask in a safe space a lot of questions. So when they need to cover it and when they need to write about it, they already have things prepared, better explained for themselves. So the interaction with journalists and partnerships is really important. Another aspect is fact checkers. fact-checking organizations, when we did a study last year together with US CDC, we partnered with the International Fact-Checking Network, and we did a survey of their membership, and half of them only consult or have health professional, a contact with health professional when they are fact-checking health-related claims. Those are definitely partnerships that are very important to have as well. So you can make yourself available, if not on social media, because you don't feel comfortable or you don't know how. There are other ways that you can amplify the reach in the information ecosystem significantly. And then, of course, one last point, I think one of your colleagues was asking, okay, well, managing the infodemic, the tools, etc. A lot of this is still evolving. And this is why it's important that we cross-share as much information as possible. So having actually a university like yours, having a way of exchanging experience, and being sort of the host or the generator of some of this evidence and discussion is a lot more effective than me posting a blog on LinkedIn, actually. And so we really need to be thinking, how we incorporate this into the culture of research, of discussion about public health and what we do.
Can I make one last point?
Just a comment very quickly, especially regarding the tools. I see, this is my opinion, from my point of view, I would add the language experts, as Johanna, myself, and Raquel, and many others we have at the university, especially those of us who work with the perspective of language as social action. So we are interested in people interacting and organizing socially through language use. So I guess those experts could also contribute a lot.
Totally.
Yeah. So
totally. And Melissa, I would challenge you, pair up with a computational scientist, because what no one has ever cracked, which I find really funny yet, is the language of memes, the language of smileys, the evolution of narrative of how people express themselves outside of words on the internet. And a lot of the emotion, a lot of communication, actually, especially among people that are more comfortable on the internet, actually is through that. And that means that if we understood that language, we should actually also be able to gain skills to engage with people through that, instead of being boring in text and infographics, for example. But that is something that is very difficult to describe, very difficult to crack, but it's very essential in people's health and well-being. So, yeah.
It takes time, but it doesn't take forever.
Yeah.
It takes time, but it doesn't take forever, so it's okay. Sorry, Johanna, go ahead.
Now, in this event, we are also talking about the importance of Brazilian educator Paulo Freire. And I think we have, as educators, a very important role here in this management, in this fight against infodemics, right? Can you just give us a final word on the importance of promoting critical thinking skills, information and media literacy, science literacy in this fight against the infodemic management?
I think actually, Johanna, you've sort of summarized it already, but also I hope that I convinced you during my talk that if we don't invest into education, these are essential skills that we need. So we needed to invest into reading, because we had, technology that made ubiquitous the books, or we had the technology that, of writing. And, we have now the internet. We need to be able to understand. We need to understand how to use it, how it affects us. We need to know, understand the nuances of information, of the digital ecosystem. We should be able to understand what we see from an algorithm curated feed, that is not the reality, that someone in my family sitting in the same location, on the same internet line, they will see different things, right? So this is extremely important skills to have: critical thinking, health, anything related to health literacy, because we bring that along through the life course. Now imagine, how important this is going to be, because our society will keep changing, the technology, the information ecosystem will keep changing. It will give us feedback, and it will not be just important for the patients and the community. It's important for us if we want to be effective in connecting with the community. So it's absolutely essential. And I would say it starts very young. But you are really doing a good job thinking about this also from the professionalization point of view. So putting it into university curriculum, putting it into graduate school, into practitioner curricula, that basically professionalizes it. It adds us another tool and another set of toolbox that we as professionals can use to the best of our ability. Just remember, all of us actually have a contribution to encouraging health behaviors. There's no profile. There's no one, like every one of us. There is something related to this. If we are thinking that we're, practicing public health, all of us are part of this. So also, seek out behavioral scientists and make them your best friend, and then share the knowledge. So, yeah.
So we thank you again. We thank you very, very much. It's been a great pleasure. Unfortunately, our time is up. We have to. Oh, Jennifer wants to say some words before we go. But so thank you very much.
No, I know we are running out of time, but I really would like, on behalf of our team here, Tina, and from the whole community, I would like to thank you so much for bringing us so many this very important reflection, and I made several notes and tips, and I think now we have our homework to do. Yes, exactly. And we, as you know, we are in the time of discussion, how to introduce this team to this subject to the curriculum, and you brought lots of ideas and tips, and I'm sure we will contact you again. And if possible, we would like to be part of this international group of discussion in Infodemics. I think we can contribute as university, and of course learn and share and share lots of information, right?
This is very generous from you, Jennifer. And I enjoyed working with your team on this. I absolutely think it's critical it's critical that we stay in touch. We will learn a lot also from your experience and what you do, and stay the beacon for the world. It's important.
Yeah, let's do our job here. And thank you so much again. And I hope to see your guys also tomorrow morning at 10:30 our time here with Kid Martin to continue this conversation, which is about the academics role exactly, and how to deal with these challenges. And thank you very much again.
Yeah, you're welcome. I hope that we meet again, virtually or personally.
For sure. We'll be in touch. Thank you so much.
Bye. Thank you, everyone. Bye-bye.